Our medical physics presentation on ultrasound by Elaine Gonzalez and myself, Alika Musalar.
Ultrasound can also be referred to as diagnostic medical sonography. An ultrasound machine is used to test an image while using sound waves to create a picture of organs inside the body. To the left of the screen, there is a picture of how the machine looks. It consists of the central processing unit along with a printer that is located at the bottom part of the machine. We then go up the machine and can see the keyboard, which is then attached to the monitor. In the picture to the right, we can see the transducer. This device is the one that physically goes on the body and sends high frequency sound waves through your body. The waves echo as they hit a dense object, such as an organ or bone. Those echoes are then reflected back into the CPU for processing. The sound waves are at too high of a pitch for the human ear to hear, but they form a picture that can be interpreted by the doctor. A fun fact about the ultrasound machine is that it does not use radiation like the X-ray and CT scan machines. If you desire to become a sonographer, you will need to at least receive an associate's degree of science in diagnostic medical sonography. If you are interested in getting an ultrasound, you can get one here in Belize City. You can get an ultrasound at BMA, which is Belize Medical Associates, or at BHPL, which is Belize Healthcare Partners Limited. You can even do it at your local KHMH for a cheaper and more reasonable price. According to Modern Healthcare's website, the average cost of an ultrasound machine is about $115,000. The low-end systems cost around $25,000 and the high-end systems cost around $250,000. The average price of a cardiac ultrasound system can cost around $162,000, and these are all in US dollars. Generally, and what ultrasounds are known for, is that it monitors the growing fetus inside a pregnant woman's uterus. The main purpose is to test to see if there are any defects or any sign of disease that the fetus may have. Ultrasound is not only efficient in pregnant women though, it is also used to examine the abdominal and pelvic organs for any abnormalities and the muscles and tendons of a person. In special cases, another name for ultrasound is echocardiogram, and this is to study the person's heart and blood vessels. If you are in the US, the average price that a patient would pay to do an ultrasound is around $150 to $400. In Belize, however, and having obtained information from KHMH, the price that a patient would pay to do an ultrasound is around $75 to $250. From this, we can see that the cost of healthcare in the US is far greater than in Belize.
The steps a patient will take to prepare for an ultrasound is dependent on the area or the organ that is being examined. The doctor may tell the patient to fast for 8 to 12 hours before the ultrasound, especially if it is the abdomen that is being examined. This is because the undigested food can block the sound waves, making it very difficult for the technician to get a clear picture. For an examination of the gallbladder, liver, pancreas, or spleen, the patient may be told to eat a fat-free meal the evening before the test, and then to fast until the procedure. However, they can drink water and take any of their medication as instructed. For other examinations, the patient may be asked to drink a lot of water and hold in their urine so that their bladder is full and better visualized. Right before the exam, the patient will change into a hospital gown. They will most likely be lying on a table with the section of their body exposed for the test. A sonographer will then apply a special lubricating jelly to their skin. This prevents the friction so that they can rub the ultrasound transducer on their skin. The jelly also helps to transmit the sound waves. Now, depending on the area being examined, the patient may need to change positions so that the technician can have better access. After the procedure, the gel will be cleaned off the patient's skin and the patient will be free to go about their normal activities after the procedure has finished. The entire procedure typically lasts less than 30 minutes depending on the area that is being examined. High contrast resolution, high fidelity transmission, one-touch image optimization, noise reduction, improved elasticity, stunning image detail, and automation are the biggest buzzwords, some of the biggest buzzwords in modern ultrasound. Over the last decade, ultrasound imaging technology has improved dramatically, creating clearer and more defined images. Real-time computer imaging has helped increase the processing speeds, which then in turn produces better images. Improved image quality then improves the rate of diagnosis accuracy, so the doctor can better attend to the patient's health needs. With the use of contrast-enhanced ultrasound, diagnostic imaging of liver lesions has taken a whole new life that would have been unprecedented not too long ago. As contrast bubbles fill the area, the technologists can capture an accurate image at 3 separate stages to diagnose the type of lesion affecting the patient. Before, this would have most likely required a biopsy to identify. The newest ultrasound machines are customizable to your preferred parameters when conducting a test. More attention is being made to the ergonomics of the machine to ensure the comfort of the user. You are going to experience less strain to your body with large adjustable LED screens, the ability to configure the height of the monitor, angle of the control console, and placement of the machine to your own specifications. So not only will the patients be benefiting from the better imaging qualities, but your own well-being will be benefited from a device that doesn't force you into uncomfortable positions. As previously mentioned in our presentation, ultrasound has high frequency waves. These are what refers to the mechanical vibrations above 20 kHz. As a mechanical longitudinal wave, sound travels in a back and forth motion and is also parallel to the direction of the wave traveled. The period is the time taken for the sound wave to complete one cycle, but as opposed to seconds, it is measured in microseconds. Wavelength is similar to period, but as opposed to time, it measures the distance traveled by the sound wave. Frequency is the number of repeated cycles, and that is measured in hertz. Acoustic velocity is the speed at which the sound wave travels, and we can determine that by multiplying the frequency and the wavelength. Speed is determined by the density and the stiffness of the medium, where the density is a concentration and the stiffness is the resistance of the material to compression. Propagation speed increases if the stiffness and the density increases. Attenuation coefficient is the parameter used to estimate the decrement of ultrasound amplitude in certain media as a function of ultrasound frequency. The attenuation coefficient increases with increase in frequency. Therefore, a consequence of attenuation is that the penetration decreases as frequency increases. A picture of attenuation coefficient is showed at the bottom of the slide here.
In ultrasound imaging, axial and lateral are the two aspects of spatial resolution. Axial resolution is the minimum separation of above and below planes along the beam axis. The axial resolution can be represented by the equation axial resolution equals the wavelength times the number of cycles per pulse divided by 2. The damping characteristics of the transducer determines the number of cycles within the pulse. Ultrasound frequency affects the resolution of the image object. Resolution can be improved by increasing frequency and reducing the beam width by focusing. Lateral resolution can determine the minimum side-by-side distance between two objects. It is determined by both ultrasonic frequency and beam width. In all, the higher frequencies have a narrower focus and provide better axial and lateral resolution. Lateral resolution can be improved by adjusting focus to reduce the beam width. The interaction of ultrasound waves is complex. When ultrasound encounters a medium, part of the ultrasound is both reflected and transmitted. The reflected and transmitted directions are given by the reflection angle θr and transmission angle θt respectively. A change in sound direction when crossing the boundary between two media is called refraction. A representation of the different angles are shown below. Here is our bibliography, and that concludes our presentation. Thank you for watching.